Okay, this is our lovely audience right here. And I'm going to turn it this way and we'll get started. Maybe. As you all know, I'm a student at Rocky Mountain Academy of Hair, Skin, and Nails. So today I'm going to demonstrate how to properly perform a basic haircut. How many of you get haircuts on a regular basis? Yes, quite a few. I bet a lot of you haven't really thought about everything that goes into a haircut. Is your stylist using the proper technique? Do they give proper consultation and ask you the right questions? In today's speech, I'm going to go over all the steps of a basic haircut or a zero cut, from consultation to technique and all the implements used in the process. We're going to look at a proper haircut from a stylist's point of view so you, as a customer, know if you're getting a proper salon service. The first step to a good haircut is using the pre-service procedure as recommended in the Milady Cosmetology Book of Hair, Skin, and Nails. First, put on a clean pair of gloves to keep your hands safe from disinfecting solution. I'm not going to do this part because I don't have a disinfecting solution and all my implements are already cleaned. Next, you need to clean all your implements, and by clean I mean use soap and water and a nylon brush to scrub them all off. Any dirt or debris can contaminate the disinfectant and make it inactive, therefore leaving you with dirty implements and an infected client. Immerse all your thoroughly cleaned, disinfected materials in an EPA-registered disinfectant. Hospital disinfectants don't work. It needs to be a disinfectant that's 100% registered by the EPA and something that the manufacturer has approved. After you've cleaned all these implements, store them in a clean, dry container after being thoroughly dried and disinfected, and put them away for use for your next client. Remove the gloves that you used during your disinfection process and throw them away. Put on a new pair of gloves and disinfect your station where the client will be seated. Now you need to gather all your materials. These materials include a cutting cape, a cutting or styling comb, hair cutting shears, a sectioning clip, shampoo and conditioner, which we won't need, a wide tooth comb, a spray bottle, a towel, and of course your client. Sanitize your hands before greeting your client once again, as to not contaminate or make your client dirty. Be prepared to greet your client and have a client consultation or intake form prepared. You're going to use this form to help gather information about your client that can further assist you in the service you're about to provide. First, greet your client by name, this is Kim, and ask them to have a seat and discuss what brought them in today. Offer them a beverage of some sort if possible. Today we know that our immobile client has somehow asked me to give her a haircut. Today we are demonstrating a zero cut, or otherwise known as a trim. A zero cut is called a zero cut because you use no elevation when you're holding the hair. A 45 would be out to here, a 90 would be to here, and a 180 would be held all the way to the top. It is important to have many different books full of different styles so your client can look through them and decide what they want in their haircut. Today, Kim can't really do much, so we're just giving her a zero and we're calling it good. But you never know with your client, they might look through something and catch their eye and change their mind at the last second, so you need to be prepared for this. You need to ask about any medical issues that may prohibit the client from receiving the service, such as cuts or abrasions on the forehead, any kind of scalp or hair disorder that might infect you and your salon and shut down your salon and prohibit further clients from getting services there. Lice or fungi is another form of this, or parasitic things in their scalp. You need to examine their scalp, ask about any medical conditions that they may have, and proceed further. If they have any of these conditions, you need to say, I can't service you, you need to go get this fixed, come back to me with a doctor's note, and then we can talk. After all of this has been discussed, you need to determine what kind of hair your client has. Do they have thick hair? Do they have thin hair, brittle, curly, wiry, straight, wavy? All of this plays into the haircut that you're about to give. Is the hair brittle and dry or slightly oily? This will play into your shampooing and conditioning process as well. Ask your client if they have any questions, comments, suggestions, or concerns about the service you are about to provide, and then proceed with your service. Record all of this information in your intake form, as you will use this for future reference. If your client comes back, you want to know what you've previously done to them, what they might need next. This is especially helpful in color, because if you color your client, you want to know what you've already put on them, so you can put it on them again. Now it is time to start your service. So first we're going to drape the client with our cape. I don't know if it'll actually stay on. Move the hair out of the way of the button so you don't button the hair. Pull the back two drapes over the chair so the hair doesn't get on their clothes. For time's sake, we're not actually going to wash and condition her today. We already know that she has very dry, brittle hair. It's not very pliable at all. Her elasticity is almost zero. So we know we're going to use a moisturizing shampoo, and BehindTheChair.com recommends that we use Joico's Moisture Recovery. Other types of shampoos and conditioners that you could possibly use, Redken is a really good shampoo. It's called Curvaceous. It's for curly hair. There's a Joico Intensities line that's for colored hair. There's also purple shampoos for blonde hair to keep your hair blonde instead of gold. There's a multitude of different things. You need to analyze your client's hair so you know what to use on them. First, you shampoo the client's hair thoroughly, rinse all of it out, make sure there's no traces of soap. Then we condition our client's hair. The conditioner needs to match the shampoo. It needs to be the same brand. If we have an overly dry client like we do today, my instructor, Kirby, would recommend a K-Pack, and this K-Pack would seal off their ends, make their hair a lot softer, and make it better for them in the long run. As you condition the client's hair, this is the perfect time for a massage. According to the Standard Cosmetology textbook, the main pressure points on the head are from the occipital and the parietal areas. You want to make sure to massage these areas adequately, as there are muscles that attach to them, and it'll de-stress your client and it'll make a better service for them. All of these muscles and attachments are listed in the anatomy part of the Standard Cosmetology book. After this, you need to rinse your client's hair thoroughly. Make sure to get all the conditioner out, otherwise they'll have a greasy scalp, and which will lead to a bad service. Then you need to towel dry the hair, which I've already done, and clean and disinfect your sink area. Spray it down with barbicide or a EPA recommended disinfectant. Wipe it down. Now we're going to go through the steps of a basic haircut. So first, I'm going to comb it out with a wide tooth comb, which I've already done. So you go through, make sure her hair is nice and combed through. Then we go through and we section it off into 3 different sections. You want to go from the top of the head to behind the ear. If her hair was thicker, I would pin it off with a sectioning clip, but because it's not, I don't really need to do that. So from the top of the head to behind the ear. And then comb it back, and then we're going to start in the back, so have your client tilt their head down. According to Paul Mitchell's website, if you do not tilt down, this will cause jumps in your hair, and you don't want a jump or you won't have a clean cut. So bring the client's hair down to 0 degrees. Position your shears directly under your fingers and go under. You want to take about 1-inch sections, cut as a time, never cut past your second knuckle or you'll probably cut yourself. And then when you get to this side, have your client tilt back and then tilt their head to the side again to avoid jumps, as we said before. And because this is a trim, we're not taking very much off. Okay. So we're just going to pretend that I did this other side. After that, we're going to blow dry it and check her thoroughly. We're going to bring each section down, and the best way to look at it is to look in a mirror and shake her head and look at the mirror, because you often see things better from a different perspective. And then after you've cut her hair, you've dried her, you repeat your pre-service procedure, clean and disinfect everything. Make sure it's all ready for your next client that comes in. But as you can see, there's quite a bit that goes into a haircut as a client. As a client, you need to make sure you're receiving the best possible service And as a stylist, you need to make sure that you're giving the best possible service. If these steps are followed, both the client and the stylist will have a good service and will hopefully come back again. Thanks for listening.